The World Health Organization has declared that COVID-19 no longer represents a global health emergency. The statement represents a major step towards ending the pandemic and comes 3 years after it first declared its highest level of alert over the virus. Officials say the virus death rate had dropped from a peak of more than 100,000 people per week in January 2021 to just over 3,500 on the 24th of April. The head of the WHO said at least 7 million people died in the pandemic. Health correspondent Kemi Balogun has details.
In the last few months, there has been a decline in hospital and intensive care admissions, leading to a decreasing trend in COVID-19 deaths. This and many more issues highlight this 15th meeting of the International Health Regulations Emergency Committee, where it has now been declared that the worst times of the pandemic is officially over. Reading the report of the 15th meeting of the IHR Committee, the Director General of the World Health Organization says the high levels of population immunity to the virus has also helped to lessen the burden of the SARS-CoV-2 pandemic in existence.
The emergency committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern. I have accepted that advice. It's therefore with great hope that I declare COVID-19 over as a global health emergency.
The International Health Regulations Emergency Committee is advising that it is time to transition to long-term management of the COVID-19 pandemic. Dr. Tedros also raised the concern that while the surveillance reporting to the World Health Body has declined significantly, there continues to be inequitable access to life-saving interventions and the pandemic fatigue continues to grow.
This virus is here to stay. It's still killing, and it's still changing. On the committee's advice, I have decided to use a provision in the international health regulations that has never been used before, to establish a review committee to develop long-term standing recommendations for countries on how to manage COVID-19 on an ongoing basis.
The highlight of the meeting was the announcement of the publication of the 2023 to 2025 COVID-19 Strategic Preparedness and Response Plan, which has been designed to guide countries in transitioning to long-term management of COVID-19. It's been 3 years since the World Health Organization declared the outbreak of the coronavirus a public health emergency of international concern. Since then, 13.3 billion vaccine doses have been administered, and the world has also recorded more than 7 million deaths. Kemi Balogun, TVC News, Abuja.
For more on this pronouncement by the World Health Organization, let's bring in a professor of virology, Oyewale Tomori, who joins us live from Atlanta. Thank you for joining us on TVC News at 10. According to the WHO, as of the 3rd of May 2023, over 6.9 million COVID-19 related deaths have been recorded. How much relief is the news that COVID-19 is no longer a global health emergency?
I think it's something we all been waiting for, that was going to happen. We are happy that we have reached that stage. It's no longer a public health emergency, but in some countries, the problem is not yet over, just like the WHO has said. Yes, the emergency is over, but it has not become an endemic problem within our system, and we must care for it. There are a lot of diseases that are endemic, which we must continue to take care of. This one has joined that list.
A closer look at the figure, Prof, tells us that perhaps we have recorded just even less than 2% mortality rate when you consider the number of those who were infected. According to W.H.O, there was over 765 million confirmed cases, and then the mortality figure is estimated at 7 million. With the privilege of the figures right now, what do you say about there's so much noise about COVID-19?
No, I think it was whether we like it or not, a disease that was spreading from one part of the world to another. with that speed, I mean, was something that would need for us to do something serious about it. It was not just the death alone that was involved. It affected so many other things. It affected people going to work. It affected the health of the people, and it affected the economy. I mean, and that I think was the major thing that kind of frightened everybody out of it. There was a standstill, a major stop. When you saw how the Nigeria went into a recession during that period, just like many other countries. So it was something. I don't think the panic was really a panic. It was something that we needed to do to bring it to a stop as quickly as possible. And the fact that that's taken 3 years actually is very worrying. And part of the problem was that the plans that were in place were not consistent throughout the whole world. And so the virus kept mutating and changing and becoming something else. If there had been that massive vaccination for everybody at about the same time, I don't think we will have the series of mutations that we had, which caused more infection over the period.
The projection during the early days of the pandemic, Prof, was that we're going to be picking up dead people on the streets of Africa. Thankfully, that didn't happen. But what lessons would you say we have learned, and how prepared is the world for another pandemic?
Good question. I mean, at the time when that prediction was made, everybody was talking out of ignorance. But the virus was just coming out. Nobody knew how it was going to behave. How many people knew it was going to end up mutating and doing what it's doing? Nobody knew. So people were looking at the past experience. When an epidemic comes to an African country, it causes devastation. Yeah, so they assume if this one came and it was killing them like it was killing Europe, it's going to be worse for us in Africa. But having said that, it is not because of what we did. It was because of what the virus did not do. And it was easy to understand why they were dying so much in Europe. Most of the people who died were elderly people who had other problems, diabetes, hypertension, and all those things. We in Africa seem to be lucky in the fact that the majority of our people were young, agile people who, got the infection and, didn't come down sick. We were using death as the marker for COVID, but that wasn't the thing. The thing was that it was affecting so many people and causing so much problem. The question you ask, are we ready? I don't think so. I don't think we are. We seem to have forgotten what has happened. I mean, see what has happened in our own country. You don't hear any more announcement about COVID, even before WHO declared it not longer an emergency. We have abandoned it ourselves. The things we used to do again, we're not doing them anymore. And all the funds we put into many of those places go back to those hospitals. They're probably back to their usual system again. These are some of the things in the laboratory support that CDC had, NCDC had. How many of those labs are functioning today? Those are the kind of things that we see we are not prepared when the next future one comes. We start from beginning again, as we always do.
Professor of Virology, Oyewale Tomori, thank you so much for your thoughts. And it's good to see you again.
My pleasure. It's my pleasure. Thank you.